Hello, my dear students. You're welcome to the Module 3 of the course Contemporary Issues Affecting Africa. In this module, we're going to discuss the healthcare policies for national development. My name is Francis Ajay. I'm a lecturer at the University of Ghana Business School. My specialty is into health policy development, health systems management, healthcare administration, and governance issues. That is what I do. That's what I do research for, and I teach. So in this course, I'm going to take you through an overview of the healthcare policy development in West Africa. Particularly, we're going to focus on the West African perspective of health policies for national development. The overview of the course is very simple. We're going to look at this course from the perspective of new public health, in the sense that we will try to understand the various concepts and the various dimensions, the various issues that are necessary for ensuring that health policies are developed to fit into the context of West African situation. Here, we all know that not too long ago, our West African continent, or the West African sub-region, has suffered some outbreaks. And time immemorial, outbreaks come and go. Every now and then, consistently, a lot of communicable diseases come up and then ravage a lot of people or a lot of societies within this region. So we're going to look at how we can formulate national policies, or what we can do in analyzing the national health systems to ensure that the failures of our national policies, the failures of the health system, could be ameliorated by some very important steps that we can take. So this module basically is to help practitioners or the participants to understand how actions, plans, procedures, policies that are taken by national government could help in helping prevent outbreaks or to prevent diseases, at the same time minimize the effects of those diseases should they come at all costs. So the outline of these presentations is going to be as follows. First, we classify or we categorize this module into three. First, we need to understand what health systems are. In that case, we will look at the meanings and the goals of health systems. We also look at the challenges that confront health systems, and also understand the components of health systems and what health systems seek to achieve. Thereafter, the second topic that we're going to discuss focuses on the developing health policies, or the development of health policies. In that one, first, we'll understand what are the goals of health policies. We'll also look at the various detailed steps that should be followed or that are normally undertaken to ensure that health policies are formulated to reflect the national context as well as the regional context of the countries involved. Then we'll finally look at the system strengthening, or how to strengthen health systems, and also monitor and evaluate performance of health systems. In that case, we will look at the monitoring evaluation, also look at the various stages that are necessary or that are followed when we want to monitor or evaluate health policies. Straightforward. Let's go into the first topic, understanding health systems. For us to understand health systems, we need to first understand what a health action is. What are health actions? A health actions basically focuses on what? Any set of activities or activities that have a primary intent of improving or maintaining the health of people. We all understand the health goes beyond the four walls of health facilities or health institutions. As we can understand, WHO met and decided long ago, even with all other definitions, health focuses not only on the biomedical aspects. There are other aspects that focus on the mental makeup of the people, the physical, the social, the economic well-being of people, not merely the absence of what? Infirmity or diseases. So any action that focuses on trying to maintain or improve the health of people can be classified as health action. So when we talk of a health system focuses on a multifaceted approach to ensuring that health actions are coordinated in a particular way that will yield to improving the health of people or maintaining the health that they have. So health system basically include all the resources, the actors, the institutions that are related to what? The financing, the regulation, the delivery, the packaging, or the provision of health services. That is what a health system is made of. Health system, in 1990, the World Health Organization has provided a succinct definition of health system that stood a test of time. Basically, it's the sum total of all organizations, all institutions, the resources whose primary purpose is to improve the health of people. Basically, so when we talk of health systems, any institution, any member, any organization that has the direct or indirect role in ensuring that the health system of people or the people's health are improved. All health systems have challenges. Specifically to West Africa, the challenges are diverse, but they are very much identical to that of many developing countries. For instance, Ghana, Ivory Coast, Liberia, the Gambia, Nigeria, all the countries in West Africa, there is a lot of underinvestment in health. When we talk of underinvestment here, we are not talking only in terms of investment into very high technology devices for delivering health services. Investment even into appropriate technology, public health investment, clinical health investment. There is a lot of underinvestment in that in these areas. Of course, another challenge that is also facing the health system of countries in this area has to do with what? Inadequate human resources or human capacity. It is for knowledge that West Africa, for instance, or African continents, train a lot of health professionals, but the majority of the professionals that are trained in terms of physicians and nurses do not work in these countries. They are trained here, but other parts of the world that have the wherewithal to attract them, pull them, so that they migrate to those parts of the world and then deliver their services. So there's a lot of inadequate human capacity to deliver health services. Of course, because of the challenges associated with underinvestment, inadequate capacity in terms of human beings, satisfaction for the public, or in terms of service satisfaction, or the public satisfaction, the services are not very much compared to that of the developed world. So there is a rare presence of public satisfaction with the services that are provided in the health system. And of course, there are also challenges of what? Inadequate utilization of the health services that are provided. So utilization in this case, sometimes distribution of resources are not equitable. So you may have certain investment in certain locations, and the patronage of those services may not necessarily commensurate the investment that has been gone into them, or that has been made into them. Of course, very obvious, has to do with what? Poor health outcomes. The outcomes in health are not very much commensurate. Take, for instance, we'll look at a table later in the last model, which will show some of the health outcomes. If you talk of all the indicators of health, middle income countries indicators, developed countries indicators, West African indicators do not match up to world averages. Regional averages for Sub-Saharan Africa, for instance, is very much way below world averages. And the specific countries also do not meet the world averages. So health indicators such as mortality ratios, morbidity statistics, life expectancy or terminal life in developing countries are below the world averages. So these are some of the challenges that these health systems face that are very much homogeneous. The challenges are homogeneous to the health systems of the countries in West Africa. So in order to tackle these challenges, we need to first of all understand what are the goals of a health policy. Or whenever we develop health policies have what? Three interwoven goals. All health policies, first of all, either seek to what? Improve the quality of health of people. Health system focus on what? Trying to what? Expand access to health facilities or health services. And also health systems also seek to reduce cost, or what we call cost containment. All right, all these three goals that are interwoven, in effect, will lead to what? these specific objectives or specific goals of a health system. So patient safety, patient satisfaction. Patients must be satisfied with the services that they have provided. The patients must be sure of their security or their safety in the health system. If a patient walks into a health facility, for instance, is that patient guaranteed the security that I'm walking into a health facility, I'll be provided the service that I require and walk out healthy? Of course, any patient that enters a health facility has certain expectations. Are those expectations met? How effective is the system that is put in place? Do the interventions or do the system's constituents put up or are properly coordinated, or are they properly organized in a way that whatever investment is made into the system actually delivers expected outcomes? That's what we are talking of effectiveness, timeliness. How timely are our services? Many of our health facilities in the West African country, you visit them, sometimes appointments are not kept. You go there, sometimes you queue for God knows how many hours, and you may never even get delivered. Issues with what? Industrial actions that face many of our health facilities. It cuts across all the countries. Ghana has experienced it. Nigeria has had its fair share. The Gambia is not excluded. Ivory Coast. A lot of turbulent issues make it impossible for timeliness to be met when it comes to the goals of the health policy in this country. Patient centeredness of service, how efficient are they in terms of access and equity? Distribution of health facilities and health resources. In most West African countries, distribution of health resources are skewed towards the urban or the so-called developed world, the most densely populated areas. Most of the health facilities are sited in the urban centers. At the same time, a lot of the health personnel seems to work mainly within the urban centers. Of course, a very important element as a goal of health policy has to do with the quality of health service. Are the qualities assured? The expectations, are they met? The tangibles, are they there? The extent to which quality of health services is guaranteed is very essential. Of course, cost containment. Can we meet the cost? Are the resources available to meet the cost that are necessary? As I said earlier, we look at the challenges of the health system. It means that in the West Africa, we may be doing certain things right. We may not be doing certain things right. Why is it that the indicators of our health do not measure up to our colleagues or at the comparable countries of West Africa in other parts of the world? Maybe in terms of resources that are available in Africa, the context of Africa is different. That means that certain things might be done differently. We may not necessarily be interested. We may not need to be investing in all the high technology, the CT scans, the MRI. Probably now when you talk of constructing a health facility in West Africa, one thing that may come to the minds of many of the policymakers has to do with what? Installation of what? MRI, high technology equipment. Yes, we may need those things, but at the same time, we need to look at the socio-cultural context as well. We'll look at all those things when it comes to health policy development. Having understood the challenges of a health system and having understood what the goals of health policy or health systems are, we need to understand what the components of health systems are. Health systems are made up of what? A lot of things. First, we talk about governance and leadership. How is the system governed? What is the leadership of the health system? Someone must assume the role of leadership. We're talking of finance. Finance is also an important element in every health system. We talk of human resources for health. Yes, human resources make up the health system. All these are important components of the health system. Of course, we're also talking about health technologies. Technology that are delivered or that are used to provide the health services that the people need. Technology, we are not talking only about advanced application of super technology, but very simple, appropriate technologies even at the community level. How to integrate diagnosis, even how to integrate traditional medicine into the mainstream orthodox health system is also a very important technology. We are talking about availability of essential drugs and vaccines. Some of the components also have to do with health research, information systems, management information systems. All these things make up the health system. So basically, every health system or a well-functioning health system must strive towards what? Improving the health status of the people, that is the families, the communities. Every health system must what? Seek to what? Defend the population against whatever threatens their health through issues of vaccination, protecting the people against the financial consequences of ill health. Here we are talking appropriate financing mechanisms. Which one will be the most affordable health financing mechanism? Should it be what? A purely state funding? Should it be purely market economy? Should it be an integration of both the government, the individual, or whichever, the other benefactors? We're also talking about what? Accessibility, or provided a health system must strive to provide what? Equitable access to the people-centered care. And the health system must make sure that it is possible for everybody to participate in the decision-making. That means when it comes to the health choices, people must be empowered. People must be given the freedom, must be given the right to decide how they participate in their health delivery. Of course, every health system must also be made up of what? Maintaining accurate information, because decisions with respect to people's health must be based on what? Facts. And these facts must be accurate. So health information system is very, very necessary when it comes to every health system. So in our part of the world, in West Africa, all countries, the Gambia, the Nigeria, Ghana, Ivory Coast, Liberia, all these countries have committed themselves to ensuring that health information systems, it probably is very much accurate. Because all these components we're talking about, which I mentioned earlier, from governance, human resources, financing, all of them very essential. None of them is more important than the other. A failure in one of these components, of which we collectively call the pillars of health system, a failure in one will be very inimical to the entire health system. It's just like a system is a sum total of all parts functioning together. So any element in that system that is affected has a direct effect on the total function of the health system. When we talk about health system governance, of course, we are talking about leadership, all right? Resources, and the delivery, the outcomes, the goal population, like this, as you see in this diagram, they all make up the health system. So collectively, a health system is made up of the governance, the delivery, the outcomes, the goal, population, resources. All of them collectively make up what? The health system. So the governance here is talking basically about what? A wide range of steering and rule-making related functions that are carried out by what? Governments, by what? Institutions that seek to what? Achieve national health policies. So governance is very key. The leadership or the direction that the state provides as far as what it wants its health status to be is very important. So for all these countries that we are talking about here, the governance or the state direction is very key. The position that the state takes with respect to what we want to achieve as a health, in terms of our health, is very important. Of course, governance is a political process, believe it or not. And when we talk of governance and leadership, it's not leadership only at the governmental level, not at the federal level, not only at the state level, but it involves all levels of our leadership, from the federal level, from the state levels, from the national level, regional levels, district level, community levels. At every level, there must be what? A governance issue. So the decentralization of decision-making within the health sector is key as one of the most important things that can help in driving the governance systems or the governance of health systems. Good. The elements of the health sector, or the elements of a governance framework, is made up of what? The elements are made up of three important things: the citizens, the state, and the service providers. The citizens, here we're talking about the beneficiaries of the services. The state, we are talking about all the machinery of government that are involved in the delivery of services. And of course, the providers. The providers here, we're looking at it from the angle of both private service providers as well as the public service providers. All of them collectively are interwoven. There's a relationship. So this diagram, for instance, illustrates a very triangular relationship between the major elements of the governance framework. The citizens, they have an influence in terms of voicing, a voice towards the state. They have power towards the service providers, and then the diagram shows it that way. Information, reporting, lobbying, issues of service provision, responsiveness, these are all interconnected in all the areas of service governance. So, as I mentioned earlier, the three major actors you have seen in the diagram have to do with the state, the service provider, the beneficiaries, or the citizens in this context. Thank you very much. Thank you very much for listening to me on the first topic. I look forward to seeing you in the next session, which we will discuss the development of health policies. Thank you.